Teri is going to tell us about some clinical ways to use the breathing techniques now and an example of how it's worked with her in practice.
I want to switch gears a little bit, and we're going to talk about actually working with our clients. So two of my favorite sayings that when I am teaching others, and just for myself and my own mindfulness, is keep it simple and less is more. So I think sometimes as therapists and healers, we have a tendency to always feel like we need to be doing something for the client. And what I love about the breath work is that it allows the client to really do their own work with us being a gentle presence and a support for them. So when we begin our work with clients, it's really important to educate them a little bit. And I find that when we speak in very simple and plain terms and we educate people in smaller amounts, this goes a really long way. It's very difficult sometimes for people just to even get into our office. So when we start flooding them with all kinds of information because we have more of a need for them to understand, I often, when I found myself doing this, see the client kind of turning off. And so what I started to back up and do is just educate in smaller amounts in simple terms. Because when our clients come in, they want to be able to understand why are they experiencing and going through the things that they're feeling or going through, or maybe a lack of feeling. They need to create some kind of meaning that's associated with the experience. So a lot of times we find out we have clients who are experiencing problems with addiction, depression. They're filled with all kinds of anxiety. And what we're really seeing is a disconnect from themselves on so many levels, physical, emotional, and especially a spiritual level. We have to look at how our clients are numbing out, they're disassociating, and they're very desperate because most people just want to feel better. They want to create that meaning and they want to understand why they're not feeling well, why they're not feeling good about themselves. We have to look at our clients and how they've experienced forms of varying levels of trauma. And often trauma, we find, is the culprit that's driving people's feelings or their lack of feelings, and especially what's driving their behaviors. Trauma is often behind so many of the addictive patterns because the thing that we know about addiction, at least first off, is that it really works. And it works for quite some time before it starts causing a lot of problems and havoc in our lives. So people will often go to that because it's instant relief. So beginning to work with people in a breathwork session alone, helping them to breathe better, provides that instant relief because all of the anxiety, all of the insecurities, whatever it is that's going on is bubbling up and percolating inside of them, and they don't know how to let it out. When we're educating with people, I think it's so important to be able to create a picture for them. So often when people can visualize, when they can see something, that's really helpful because it's moving along as if you're watching a movie or on a movie screen. And then people get it because they can see it in their mind's eye. When we look at creating a space for our client, it's so important to take a look at our physical space. When our clients come in, we want them to feel invited. We want them to feel warm. So you need to create a space that's relaxing. You might want to have some softer lights, an oversized chair. I was very lucky that I had the luxury of having a healing room where I had a massage table that people could lay on and do some of the breath work. Now, all people may not have that luxury, but it's really important that your physical space is inviting. It's important that you point out to them or that they're very aware of where the door is, because often people who are traumatized, they need to know that there's a way out. So we want to begin by creating a space that's inviting, that feels safe for our client. When you're sitting with your client, it's also helpful not to sit directly in front of them. Sometimes I'll just slightly turn myself to the side because, again, I'm not honing in that person's field. I'm giving them some space. When we go back to educating our client and making things very simple, sometimes I will actually get a brain so that I can actually point out the different parts of the brain when I'm talking about trauma so that they can understand where the different parts of the brain are, where trauma lives, and what's going on. I'll often sometimes just make it very simple and say, there's separate parts of the brain, and the first part is called the sideways split. And it's the left side of the brain, and it likes to be in charge. It likes to make all of the decisions. It does the thinking and the analyzing. And then I'll go on to say the middle brain is in charge of vision, hearing, and motor function, movement. It also stores the limbic system, which allows us to feel our emotions. And then we have the hindbrain, which is located in the back of the base of the neck. And I'll actually kind of show my client where that's located in the back of the neck. And I'll have them touch it themselves on their own neck, because here again, we're connecting that for them. And explaining to them that this is a very primitive part of the brain, that it connects our spinal column and our central nervous system. And it's where our basic instincts and our emotions are stored. When we're painting that picture, it helps our client to see, and it helps them to understand what we're talking about. And this is really important in breath work as well. We don't want to get overcomplicated when we're having people breathe. We want to keep it simple. We want to hold that space for people. The other reason why it's very important to help your client be able to visualize is that when they are in a safe place, they need to create that safe place for them when they're doing the work, because sometimes people get very flooded. I like to call it a sacred space. This helps our client to visualize a setting where they can go in their mind if it gets too overwhelming. And a lot of times when clients haven't allowed themselves to feel emotions and they've stuffed them down for so long, that's huge. That's like a volcano erupting for clients. Even myself, when I haven't dealt with something for a long time and I get emotional, it's like a tornado churning up. And so sometimes I feel overwhelmed. I get flooded. And instead of shutting down, this is a perfect place where you can work with your client and just by saying to them, go to your safe place. So we're going to work with that a little bit because it's really important to create that. So when I'm creating a safe, or some of my clients like it to be called a sacred place, I like to call it a sacred place because it makes it feel like there's something very special about it and it belongs to just me. So what I will work with them is I'll have them close their eyes and I will ask them to think of a place where they feel very calm, where they feel tranquil, a place that puts them at ease. And I'll just have them raise their hand or say out loud to me as we're going on this journey together, let me know when you're there. And my client will do that. And what I'll ask them is to describe their safe place. This allows me to be on the journey with them, but what it also does is it really implants it in their mind as part of the visualization of where they need to go. If they can work with their senses and they can tell me what they see in their safe place, they can tell me their surroundings, they can tell me what they hear. What is the weather like if you're outside? Is it sunny? Is it raining? Do you notice any smells? The more sensory things that we can bring into this, the easier it's going to be for your client to be able to ground themselves again, or when they're feeling totally overwhelmed as they are going through a breathwork session, to be able to just come back to center for a minute and then go on to continue the work. This often happens with other modalities such as EMDR, brain spotting, where there's an overflooding sometimes, and we just need to be able to provide that safe place and to take those breaths so that the client can come back in and continue doing the work. The other technique that you can use for grounding, sometimes that's very quick and simple, is to just ask your client to look at their hands and to say, how old are you? This will give you an idea of where they're operating. I've had clients who come in and say, my hands are 5 years old. So I know that they're struggling or they're working with that inner child if they're an adult. So it's helping them to realize, helping you to realize as the therapist, as they're going through this work, where are they in this process? Another one is to help them look at their hands and their feet and to see them as firmly planted on the ground. And one of the last other exercises is 5, 4, 3, 2, 1, just having them count backwards. It brings them out of wherever they are and brings them back to center. You can also have them name 5 things that they see in the room, 4 things that you can feel, 3 things you can hear, 2 things you can smell right now, and name 1 positive thing about yourself. So that's the 5, 4, 3, 2, 1. They can count it back and then go on to name the different things that they notice. This will help ground your client so that they're able to move forward in the session. The other piece that I think is really vitally important, and sometimes we forget to do some of this, is to really establish resources for our clients. Often the therapist becomes the resource for the client. And I think that's a good thing. We need to be there for our clients when they're in crisis, but we also need to help our clients establish resources outside of the counseling session. So often I will sit and create a list with them and go over that list so that they have those resources to utilize after the breathwork session. This could be comprised of people that they trust in their lives, places that they feel that they can go, community support meetings. Especially when we're dealing with addiction, it's so important to encourage our clients to be taking part in community support meetings, in AA, NA, where they can get that added support outside of the counseling session. I also encourage them to name activities that help them to feel relaxed, help them to feel in a creative state. And then going through all of those activities so that, again, they have a list of that resource, they have it near them when they need it, so that they have other reinforcements outside of the session. So now we're going to talk a little bit about reinforcement tools. And when after a breathwork session, some of those tools that we can utilize with our clients. So breathing, that's the main part of the session as we're watching people breathe, as we're breathing with them, as they're processing things that come up through the breath. It's really important in your session to save time to be able to do that processing. And that can take form in a lot of different ways. So examples include talking to the client about how they felt, asking them, what was most helpful for you in this session? What was most meaningful? What were some of the insights that you gained? Often I like to close my sessions with the client by them setting a mantra or a few words of empowerment that they can take home with them and they can say over and over again. And often I will ask somebody, where do you feel that in your body? And I would say probably 70% of the time, people go to their heart, that heart space that Jim talked about earlier. And I'll actually have them place their hands on their heart, and whatever words that they've used to identify from the session, I'll actually have them say those words out loud. And then I'll ask them to take an inhale and exhale. And the last thing I ask them to do is seal that in. Be present. Remember what this feels like. This is another resource that when they're not feeling so well, they can go back to those 3 words. They can actually bring their hands to their heart at home, and they can go through that same process of breathing and bringing it in. Another great way to process with your client is to have them draw. There are studies that show for people just moving a pencil over paper or crayons over paper can be very relaxing. It can be almost hypnagogic for people. And often when people can't find the words to say, it's so much easier to hand them a crayon, a marker, or a pencil and a piece of paper and just let them draw or put on paper whatever it is that they're feeling. And it gives them sometimes a starting point of being able to talk about their feelings. And for some people, this is a way for them to really begin to integrate the session. They also have a little piece of artwork that they can take home with them as a reminder. clients also need to develop the affirmations and the mantra that we talked about. And this is something that's really helpful as a resource tool as well, because when they start to feel anxiety, when they're feeling down and depressed, they can just simply say those 3 words out loud, and it brings them back to presence. And again, taking the breath with it, because we want our clients to be able to practice their breathing outside of the session.